you've injured your anterior cruciate ligament or ACL, did you know that you may not necessarily need surgery? I'm Dr. O'Donovan, and in this video we're going to cover key things you need to know about ACL injuries, including what they are, how they happen, and crucially why some people can recover without surgery while others may still need an operation. And this is what the main focus of this video will be about. And later on in the video, I will explain the circumstances where you may not need surgery and what the treatment options can include. And as always, this video is intended as general education only. If you've injured your knee or it feels unstable, please always see your own physiotherapist or doctor for personalised advice. So firstly, what exactly is the ACL? Well, inside the knee, we've got several important ligaments. And one of the key ones is the Anterior Cruciate Ligament, or ACL for short. It runs diagonally through the centre of the knee and connects the thigh bone to the shin bone. It works a bit like a strong internal seatbelt, helping to keep the knee stable during twisting, pivoting, and sudden change of direction movements. It also plays an important role in what we call proprioception, which is your body's ability to sense position and balance. So when the ACL is torn, it's not only the physical support that's affected, the knee can also feel less trustworthy or a bit unpredictable during movement. So now we know what the ACL is, well, how do ACL injuries usually happen? Well, most ACL injuries happen during sports, often in situations when someone pivots sharply, lands awkwardly from a jump, or suddenly changes direction while the foot stays planted. Think of sports like football, netball, basketball, or skiing, those kinds of sudden, sharp movements. Now, common movements leading to an ACL injury can include pivoting, meaning twisting your knee, particularly when the foot is firmly planted on the ground, such as during a sharp turn. Sudden stops or changes in direction are also a common mechanism of injury. So for example, abruptly slowing down or cutting to one side whilst running or walking. Awkward landings, such as landing from a jump with poor control, which can cause the knee to buckle inward, or hyperextension, which is overextending the knee joint, often during an awkward fall, or sudden deceleration are also common mechanisms of injury. Now, other contributing factors can include a direct impact, meaning a collision with another person or object in contact sports, poor stability, including weak muscles in the hamstrings, quadriceps, and the core, and this can also make the knee more vulnerable to injury. Now, many people do describe or feel a pop followed by a pain, swelling, and a sense that the knee just isn't right. Sometimes the ACL can also tear by itself, known as spontaneous rupture. Other times it gets damaged at the same time as other important tissues in the knee, like the shock-absorbing cartilage, which is known as the meniscus, or other supporting ligaments surrounding the knee. Now, because of this, injuries can range from mild to very serious, and this is going to impact the choice of management. So now we know some of the potential causes. Well, how do we diagnose an ACL tear? Now, in the first few days, it can actually be quite difficult to examine the knee properly because swelling and pain can mask some of the findings. So often, a diagnosis comes from a combination of a couple of things. Firstly, the story of how the injury happened. This is known as the history. Next, a physical examination once things have settled a little. And for those of you who are interested in this, I've actually included another video I made on how the knee is examined here. And then also a scan, so typically an MRI scan to confirm the injury and check for associated damage. Now, in very rare cases, if things are still not fully clear, specialists may use keyhole surgery called arthroscopy to get a direct look inside the knee. So now let's move on to the part of the video that you've been waiting for, and that is, does every ACL tear need surgery? And here's what a lot of people are surprised about, because the answer is no, not necessarily. We used to think that every ACL tear needed reconstruction via surgery, but we now know that many people do well without surgery, especially if they don't need to return to high-demand pivoting sports, for example. Now, non-operative management focuses on calming the knee down in the early stages, restoring movement, rebuilding strength in the muscles surrounding the knee, so the quadriceps, hamstrings, and also the glutes and the core, as well as retraining balance and knee control. That is the proprioception that I mentioned earlier. Now, this is not a quick fix, but with consistent rehab and guidance from a specialist physiotherapist, many people actually return to day-to-day life, running, gym training, and recreational support with a strong, confident knee. So generally, who does well without surgery? So according to the American Academy of Orthopaedic Surgeons, non-surgical management of isolated ACL tears is likely to be successful or may be recommended for patients with partial tears and no instability symptoms, for patients with complete tears who don't experience symptoms of knee instability during low demand sports and are willing to give up high demand sports, and for patients who do light manual work or live what we call predominantly sedentary or inactive lifestyles. Now, it's also important to note that there is also increasing evidence that children with ACL tears are at higher risk for future damage to the meniscus or cartilage with non-surgical management. So it is worth bearing this in mind if you're talking about a child who has an ACL injury. If your child or adolescent has open growth plates and an ACL tear, then talk to the surgeon about the risks and benefits of surgery, as the growth plates can be avoided with certain surgical techniques. Now, it's also worth saying that not everyone with an ACL tear develops long-term instability. The knee can be incredibly adaptable when the right muscles and movement patterns are trained. Now, a question that I'm also asked a lot about is, should I wear a knee brace? Now, for everyday life, most people don't need one, but in certain situations, so skiing or squash, a structured ACL brace can provide a sense of security and reduce the risk of giving way, but this is going to be an individual choice. Now, think of it as a supportive tool, while your strength and confidence build, not a long-term replacement for rehab. Ultimately, rehab is the most important thing. Finally, when is surgery the right option? Well, surgery is still very important for some people, particularly those who continue to experience knee giving way episodes despite structured physiotherapy, or those who want to return to pivoting or competitive sport, or those who've had a very serious injury such as a complete tear. It's really important that you have got an open and informed discussion with your health provider or surgeon and make sure that you make the right decision for you. Now, if surgery is the right choice, procedure is called an ACL reconstruction, where the damaged ligament is replaced with a graft, usually from your own hamstring or kneecap tendon. And a key point, whether you go down the surgical route or not, rehab is essential. As I mentioned, after reconstruction, it typically takes 9 to 12 months of continuous structured physiotherapy to safely return to high-level sport. So a personalised structured physiotherapy program is absolutely crucial to aid optimal recovery. So the big message here that I want you to take away is an ACL tear does not automatically mean you need surgery. In certain circumstances, for example, individuals with partial tears who don't plan to return to high-impact sport and stick to a well-structured rehab program, recovery can happen extremely well with physiotherapy-led rehab. Focusing on strength, control, and confidence in the knee is really important, but for others, particularly competitive athletes or those with persistent instability, surgery is generally the best choice. But ultimately, the right pathway depends on you, your goals, your knee, as well as your lifestyle, which is why it is so important to work closely with your physiotherapist and orthopaedic specialist to decide what fits best for you. If you've had an ACL injury or you're going through rehab right now, please let me know in the comments how it's going and what has been most helpful for you. I'm sure other people watching this video will find this kind of information really, really helpful. If you did find this video useful, please consider liking the video and subscribing for more clear, evidence-based health information. Take care and see you next time.